And welcome to our final case, Thursday, June 13, 2024. Our patient travels here from Panama. Beautiful Panama. He has a disc injury at L4-5 with a little bit of slippage, and we're going to go in and repair this disc with our laser. This is done endoscopically. The patient is comfortably resting on the bed. Hopefully it stays that way. All right, it's a little higher than I want to be, so I'm going to start a little bit lower. We'll put some numbing medicine as we go down, but the first step is to place a spinal needle through the foramen into the disc that's damaged. Excellent. You can see show us the L4-5 disc, Jordan. You all see the L4-5 disc?
Yes, we do.
And show us the back of the disc. Right there is where the pain is coming from. That's the posterior annular tear. We're going to go in there and repair that area with the laser. Okay? Now, we've all been told for many years that this type of an injury and the spine requires fusion, but it doesn't. I used to believe it required fusion myself as a spine surgeon. That's what I was told by my teachers. However, once I started doing these laser surgeries, I realized we can fix these problems without fusion. We can fix them with the laser surgery. And there's no need for any fusion whatsoever. Shot? All right. I'm going to go a little bit wider. Shot? How's our last patient doing? Just go good to hear. Shot? All right. We're going to get in, and I will tell you a secret low in the foramen, since you're all still here watching. Henry, let's show our audience why do people get pain from a disc injury? Are we going to be able to do a discogram today or not?
Try.
We're ready right now.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
All right. Well, you see now, you can see now why we're laughing. We're talking to our patient, trying to figure out how much pain he had when we did the discogram. You can clearly see him pick his body up there. Yeah, that was not a good experience. So we know the disc is painful, and now we're going to go and repair it. You could see from our video that the injury to the disc is in the back wall. It then gets herniated, and then once the herniation happens, you get inflammation. And the inflammation is what brings the pain, the duele. Can I proceed, Shot? All right, now as we go down with the dilator, we're spreading the tissues apart. I'm going to put some more numbing medicine deeper inside. That's going to help the patient be more comfortable. I should say the patient and the anesthesiologist. Do we have any questions?
At this moment, no current questions.
Uh-huh. All right. Blood pressure is good? All right, let's go ahead and advance. We need a Raytech sponge. Uh-huh. Ready? Shot? All right, he's moving. This is definitely the bad disc. Shot? Which video are you showing, Henry?
Oh, we're still, we finished the discogenic
All right,
back
let's
pain.
show the video while we're waiting. We're going to put the patient deeper asleep. Let's show the video on how the laser works.
Copy that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see we have a tube going into the disc, and the endoscope now is there. You can see the view through the endoscope, same view that I see as the surgeon. And there's our first piece of herniation. Some of the herniation can be removed with the grabber. The rest of it has to be removed with the laser. How's he doing, guys? Yeah, from my standpoint, he's perfectly fine. You don't need to make him any deeper. At least not right now. We're gonna be in the deeper part of the disc for a little while, or not disc, but the tear. And we'll take any questions you have, Henry.
This first question coming from Lanu on YouTube,
Lanu, welcome back.
asking, can coughing or sneezing can cause a herniated disc?
No, coughing and sneezing will not cause a herniated disc, Lanu. The first thing that must happen is there must be trauma, substantial trauma to the disc. That's a hyperflexion, hyperextension, rotation, lateral bending, some type of horrible twisting with severe force. Fall, car accident. That will cause a tear in the back wall of the disc. Then, after that tear, you can do coughing and sneezing, and then it will cause herniation of the nucleus. But a cough and a sneeze by itself will never cause a herniated disc.
We have two other questions.
Sure.
This next one coming from Tracy on Facebook,
Hello, Tracy on Facebook.
asking what might be the frequency when you see somebody re-herniate the same disc after a DLDR, and also have a great weekend, everybody. You worked hard and deserve it.
Thanks, Tracy. The frequency we know for reherniation after a DLDR is 1%. It does happen. Unfortunately, we have patients that reherniate, and we've done now over 2,000 DLDR surgeries. We've had 20 patients reherniate. By the way, I would not trust anyone else's opinion about the reherniation. You're going to want to, if you have had the DLDR, you're concerned about a reherniation, you're going to want to meet with me and let me evaluate what's going on. Because there's so much misinterpretation, 5 minutes, of what's causing symptoms in patients. And patients are not capable of making that determination themselves. Other doctors are not capable of making a determination of whether or not you've had a reherniation from a Deuk laser disc repair. Only I can do that. There was another question.
Yes. Next question from Tracy once more on Facebook asking, can you explain why coughing and sneezing can exacerbate disc pain?
Sure. Coughing and sneezing both cause increased abdominal pressure. It's called Valsalva. And they also cause flexion of the spine where you're bending forward. That puts pressure on the disc. And of course it puts pressure on the front of the disc, which then pushes herniation out the back. A lot of scar tissue here. None of this is normal. This is very scarred, very calcified, very abnormal. Right here, what we're seeing. This is not a normal disc. We're able to see inside this disc tear, inside the herniation, and this is all from damage to the disc, what we're seeing. All this white stuff is not normal. Normal disc doesn't look like this. This has, normal disc does not contain scar tissue. This has scar tissue. And you see the calcium, the gold color when I hit it with the laser? That should not be there either. Now on the left side, you can see the end plate of L4. That's the bone that's above the disc. And on the right side, you'll be able to see the end plate of L5. This fiber is just not turning the way I want it to. Those little strands right there are part of the annulus fibrosus. And you can see the herniation right here is stuck inside the torn annulus fibrosus. The annulus fibrosis is the annulus for brief, for short. We call it the annulus, but it's the annulus fibrosis. That's the official name. You can see why it's fibrous, has fibers. Right? This is all herniation here. You see how the herniation is right inside the annulus. This should not be here. The fiber is 1 millimeter, the glass fiber. That gives you a size reference so you can understand how big everything is here. It's very small.
We have a couple more questions.
Be happy to take them.
This next one from Lanu once more on YouTube asking why herniated disc is never taught in public school.
Yeah, it's a great question because, Lanu, I think, well, first of all, doctors look at the herniated disc as the cause of leg pain. And there's not many people with sciatica in the world. There are millions and millions, tens of millions of people with back pain. But doctors don't understand the herniated disc is the cause of back pain. If the world understood the herniated disc is the cause of back pain, then everyone would be talking about it more. But we're the ones who discovered this at Deuk Spine. And it's not been widely accepted yet. It will eventually be once everybody understands. But until then, doctors talk about back pain as being something that nobody knows why patients have back pain. It's unknown. It's a mystery. So even though back pain is a big public health problem, the cause of back pain is unknown to doctors. Except at Deuk Spine, we know the causes of back pain. We discovered the causes of back pain. 5 minutes? No. 4 minutes? We're almost done. I'm right at the outer part of the disc. I just have to clean it. Clean the rest of this and we're done. Let's have the grabber. There's some really old herniation in there, you can see. Any other questions?
Yes, we have a question from Mixing On Up once more on YouTube, asking, do you guys have treatments for TMJ? If so, what are they? Thought I saw a video of you guys mentioning TMJ.
Yes, yes. TMJ is temporomandibular joint pain. We don't normally treat it, but we can. Our treatments are just injection of pain medicine that numbs it up, makes the patient feel better for a little while, maybe a little steroid. But the real treatment of TMJ is done by what? Orthodontist? ENT? Yeah. So I would not come to Deuk Spine for TMJ. That's not something we really treat. See an ear, nose, and throat doctor, ENT doctor. That's what Dr. Berndes says. Or oral maxillofacial surgeon, OMFS. Yeah. I mean, we can just do shots, that's all. We can't fix TMJ. Like we can fix... They do it laparoscopic for TMJ. Dr. Berndes says they have new technique where they use it endoscope, just like we do it. Huh? They clean up the joints arthritis? Really? Really? Well, you know, someday we may actually be doing it. No, you know, we never thought about it, but if it's an arthritic joint, can you hold that open, please? Then it's something we can eventually treat. I'm glad you mentioned it, by the way. Now you got me thinking about fixing it. Fascinating. I had no idea it was arthritis. That's what we fix with the Deuk plasma rhizotomy. We may actually become the TMJ treaters. I got to figure out where the nerve supply is to that joint. If I can figure that out, I can treat it. It's a big problem. Yeah, we've successfully treated other joints with arthritis using our Deuk plasma rhizotomy technique. All right, 1 minute left. We'll be done. Any more questions?
Yes, we have a question from Tracy once more on Facebook asking, curious how long you've been performing lumbar DLDRs, and do you have any long-term stats on pain reoccurrence?
Yeah, Tracy, we've been doing lumbar DLDR for 18 years. We have the longest term stats, 7-year follow-up patients with DLDR, 92% pain relief, 7 years on average, 92%. And I think it's actually higher than that personally, but that was the best data we could get. Yeah, when patients develop pain after the DLDR, it's not from the disc that we fixed, it's from something else. Unfortunately, a lot of patients will go somewhere else and they'll get some other doctor telling them something else, and then they get very confused, which is why I discourage them from doing that. Then they end up getting procedures they don't need. We had a patient recently who we fixed his back. He went back home. He was doing fantastic. Then he started having horrible pain in his back and his leg. He went to his doctor. They said, oh, you need spine surgery. He said, I just had it done at Deuk Spine. And they said, well, they didn't do anything and you need to get another surgery done. Well, he said, I don't believe them. I'm going to go see Dr. Deuk. They wanted to do a fusion, like 5-level fusion. I said, don't let him fuse you. Come see me. Came in and saw me, and it wasn't his back at all. It was his hamstring muscle was ripped right off the bone. So he had to go get his hamstring reattached, and he had 0 back pain and 0 sciatica. Those doctors would have done a 5-level fusion on him, remember? From New York. They wouldn't have got any better with the surgery. No, that's why so many people have back surgery, they don't get better. because their doctors are doing the wrong treatment.
Or the doctors don't examine.
No, the doctors don't. They just look at the MRI and they make a decision based on the MRI rather than where the pain's actually coming from. So if somebody's had a DLDR, they're having pain, their best option is to see me and get a diagnosis, not go somewhere else and get a misdiagnosis. All right, we got pieces of herniation here. You guys see that?
Yes, we do.
That was quick reflexes. All right, good enough. All right, I'm going to hold a little pressure for a minute, but everything went very well for our patient. You can see the incision is only 7 millimeter, tiny. We're going to get the staples out tomorrow. There is actually quite a bit of pieces of herniation, you know, on him. And you can see, look at all these here, Henry. This is just some of it. Henry?
Yes, we can see it.
Yeah, there's even more. All right, thanks for joining us. Any other questions?
One question remaining from Lanu once more on YouTube asking, there are high school students that have herniated discs. If the students want the surgery, do they need parents' permission?
Yes. Yes, students that are in high school, if they're a minor, 18, younger than 18, they need either their parent or guardian or whoever their legal guardian is that has power of attorney to make decisions for them, for us to be able to do any treatment. Great question. All right, thanks for joining us. I'm Dr. Deuk Majan. It's been a pleasure. Surgeries today went very well. I want to thank my whole team and thank you all for joining us. Have a wonderful weekend.